make the cause worse.
Okay. Have you tried the ice cream in Baskin Robbins? Have you tried the ice creams, the Solero one? How does it taste like? It's like very, very sweet, you know? Okay. Yeah. So even my own kids, right? This sweetness, right, is very sticky, you know? It tends to have like this, like coughing effects for kids, all right? And then, especially for children who has this asthmatic attack, right? Bronchospasm because of asthma. Cold drinks, cold weather, ice cream, all this, especially if they take it at night, right? When it's raining, you know, it tend to cause bronchospasm. So that's why I say no cold drink, no ice cream, just for like about 1 or 2 weeks. And then, if they are well, then you can take, but not every day lah. Okay? Because you know, sometimes they come back from school, like one pakcik one kedai there, okay, outside school, then one auntie sell ice cream Malaysia, and then they will eat every day. The parents don't even know, right? So when you ask them quietly, adik, you go and eat ice cream and say, ya Allah, so hot. So I must eat ice cream. Doctor, RM1 only. I still got balance. Okay? So, and then the water and then the colouring as well. You know, when they make this ice cream, you know, the batang ice cream one, so they gigit. So they...
Hello.
All right. Okay. So I think it is not like the rule, but usually I would advise not to avoidance lah. Okay. All right. Any other question?
Will cause the cells to be swollen up, and it give all this reaction and produce a lot of like macrophages lah, all this the inflammatory reaction. That's the extreme change of the temperature. That's why you realize some patients they're not allergic to cold, but when they go out from the car outside, they start to have flu. Why is it my runny nose happen when they change? It's because of the extreme change of the temperature. It caused somehow the body to have all this inflammatory reaction. Suddenly, all the cells swallow up and start to secrete the phlegm. That's the reason. Yes. It's by experience. Okay, they don't need degree to know that.
Okay, you guys got any other questions, either for Dr. Belinda or for our Dr. Farzana? Anyone? Please get this chance to actually ask any kind of concerns that you have encountered in your clinics or in your practice settings.
During dinner, I think everybody's like concentrating on dinner and food now. Yeah. Okay.
Okay. If not, I have yes.
Okay. The off-label. Usually, anything like anybody more than 1 year, I can give already lah. Yes. It's licensed for 2 years and above. But you know, my friends in Singapore and you know my friends who's actually pediatric respi in UK, they start to use it 1 year and above lah. Okay, if the symptoms are severe, like a lot of productive cough, actually it works. Okay, and there's almost always no side effects like if you use like a small dose. Like BD dose is like very small dose, and you know 100 milligrams is like available and it's easy. You know Flumasil for children, if you buy the sachet one, yeah, when you bancho that Flumasil, right, it becomes orange, okay? And the taste is very nice. It's like orangey, lemony kind of taste. So yeah, but then you just mix with like 2 cc, 3 cc of water lah. It's not like a lot, okay? It comes in a small sachet. Do you guys bring the Flumasil? No, okay. It's like a small sachet, like very small. Once you dissolve it, it becomes like orange, and the taste is very nice. Okay, but some children they don't like it because probably they don't like orange. Yep. For 5 days. Try for 5 days first, yes. Okay? So if it doesn't work, if they come back after 1 week, usually I get them to come back after 1 week. If it doesn't work, then you have to explore what are the other things that this person might have. Okay? Probably. Never listen to your grandmother. Huh? Yes? Yes?
Thank you. Hi, Dr. Amlinesh. So I understand that N-acetylcysteine we also use for PCM toxicity. And then some patient, they have palpitation after taking N-acetylcysteine. How about when we give for patient with mucus plug accumulation for N-acetylcysteine? Is it something like a dose-dependent kind of side effects, or it's not a common side effects about palpitation? Yeah.
Yeah. Yeah.
The dose of 1,200, 600, and 200, right? They have effect, and then the side effect is not really dose dependent, and it's mostly GI side effect rather than the palpitation. So this is very interesting. I've never encountered one, okay? But if you happen to have a few cases, maybe you can raise to EP to take note and then see whether there's any feedback from the company lah. Talking about that, yeah, I have also questions. Is there any documented dryness of mouth after the flumasil intake?
So far for that side effects, no, don't have. We don't have the documented dryness of mouth after they take NACs. So, but of course, if you're getting more and more cases with this kind of side effects, then we may need to raise up this concern to our manufacturer. Of course, if any doctors here that you have encountered this kind of side effects, can just let me know. Okay, then I may need to collect some information from the doctors who experienced this. Okay, yep. Dr. Farzana, you have anything to add on for that?
Yes. License 2 years and above?
Yeah.
2 years and above, yes.
2 years and above. What about the people, infants and for less than 1 year or something like that, having bronchiolitis, no? Bronchiolitis, having chronic cough. How is
The way to go for us, I used to be under Prof. Boo. Whoever goes to UKM will know who Prof. Boo is. So, she only used, for small babies, even the premature babies with a lot of cough, secretion, we use bromhexine. Okay, that is the safest for smaller children, like less than 1 year old. Okay, bromhexine, yeah. Okay. Oh, okay. Cystic fibrosis in Malaysia, unfortunately, children, it's good lah. We don't really have a lot of cystic fibrosis, okay? Even in GHKL, when I was in RESPI, at that time, KKM doesn't really have budget yet for Flumasil, right? They only have budget just recently lah. Okay, but in UK, when we use Flumasil, usually cystic fibrosis is another pathology. You see, the one that we use Flumasil for is, for us, usually we use it for acute infection. Okay, for all these chronic diseases, how long are you going to use it for? That's the issue. And then cystic fibrosis, actually, there's an underlying mechanism that you can't you can't do anything, right?
Study lah they did for cystic fibrosis, but I think more of this antifibrous formation because it has some antioxidative agent, right? So whether it's really truly benefit or not, I think they need bigger study lah. Small study ones they did say some improvement, but whether it's significant or not, we don't know lah. So I think for Malaysia maybe we need more study, or maybe in future I've seen the research on flumasil with cystic fibrosis benefit, but alongside with the COPD lah, with this chronic bronchitis lah. Really is cystic fibrosis alone, whether it's give big different, I don't have any evidence on that lah. We assume when we have chronic cough in post-TB, it always goes back to emphysematous changes, or it's actually a bronchiectatic changes, okay? Or maybe patients having chronic bronchitis lah, because of the sequelae from the infection, sorry. So sequelae from the previous TB, right? So this group of patients benefit from the flumacyl. And in fact, they did a study, they can use up to 6 months of the flumacyl usage, safe, at the same time it reduce the symptoms. So maybe it's something that we can consider, but most of the time, if really is emphysematous changes, bronchiectasis changes, maybe becoming a chronic obstructive, they may need additional like bronchodilator agent, all this, puff inhalers, that helps to improve the symptoms better. Difficult to say, but then yes. Yeah, it's an expensive disease lah. Okay, I should not say anything about it.
No worries, because it's well-known, okay? Yeah. But then also I want to add on with what Dr. Belinda just now actually sharing on the safety profile of flumacyl. So like how long can the patients be taking flumacyl? Our longest study so far is the Pantheon study. It's on 1,000 Chinese subjects. So they have been using 600 mg PD doses for up to a year. During this study, this is the longest study that we have. They use it for up to a year. The safety profile for the subjects is similar to the control group. So disregards whether they take NACs or they didn't take NACs, the safety profile is similar. Okay, so this is what we have for now, but who knows in the future, they may do a bigger study and a longer study. But so far, that's the longest that we have for a year. Yep. But of course, so far, like for Dr. Belinda, I have some experience giving for a few months already. So there's also a good testimonial on the products as well. COPD, sorry, COPD cases. Yes, COPD with bronchiectasis, all that kind of cases. Yeah, it's a chronic disease, yes, sorry. This study is on the chronic disease and the COPD cases. Because normally for NACs, our recommended is about 5 to 10 days for acute cases. So about 1 to 2 weeks. But of course for chronic, normally some patients, they may need to take lifelong. Yeah. I have one doctor that she's already used for her father. She used for a few years already. So far, doesn't have any kinds of undesirable side effects. Okay.